Psychotherapy involves going to see a therapist on a regular basis, often once a week. I'm Dr. Susan Samuels, and I'm an assistant professor of clinical psychiatry at New York Presbyterian Hospital, Weill Cornell Medical College. There are three main types of psychotherapy that we use to treat depression. With cognitive behavioral therapy, we focus on thoughts. With interpersonal psychotherapy, we focus on feelings. And the psychodynamic psychotherapy, which is the most widely used type of psychotherapy, we focus more on your life story. The theory behind cognitive behavioral therapy is that if we can change how we think about something, then we can also change how we feel and then how we act. We all have automatic thoughts that are actually pretty natural. We sort of think in the extremes, like black and white thinking, it's you're all in or you're all out, or we catastrophize, we think about the worst case scenario. Sometimes the automatic thoughts, though, can become dysfunctional and kind of get in our way. So the idea is that you have an automatic thought, you're aware that those things happen, and when that does happen, you consciously challenge that thought so that you might be able to change it just slightly. Not to discount it altogether, because it's a real thing and you are really thinking that, but maybe if you can alter it just a little bit, then your feeling is a little bit different, then you behave differently, and then you can respond to life stressors in a way that is more beneficial to you. Interpersonal therapy really focuses on interactions that you have with people around you, like friends, family, and coworkers. Sometimes when people are depressed, they notice that they have a lot of interpersonal conflicts across the board, at home, at work, with friends, with family, and they're having a really hard time resolving those conflicts. So IPT, or interpersonal psychotherapy, can really help people understand where those conflicts might come from and how they might better improve their communication skills. If you're able to improve your communication skills, have improved self-esteem, and perhaps you're less depressed, then you're able to resolve those conflicts with your peers, with your coworkers, with your family in a more effective way. Psychodynamic psychotherapy is the most widely practiced form of psychotherapy in the United States. The focus of psychodynamic psychotherapy is really understanding your life story, going back to even childhood and understanding how your experiences from growing up and perhaps during your adulthood as well affect how you act and how you feel. Understanding your life story in therapy can really help you understand maybe your deeper rooted causes of depression that you may not even be aware of, that might be unconscious, and you might really need somebody to help you explore where all of those thoughts and those feelings have actually come from. The idea of this type of therapy is that by talking about your experiences, you better understand them and you're better able to cope with your feelings. In truth, in most psychotherapy, you'll see kind of a combination of all three different types of psychotherapy that we're talking about today. There really are many different types of psychotherapy, but these three are the ones that we use the most commonly for people who are suffering from depression.